Diagnosis in the pregnancy. Diagnosis of pregnancy involves a clinical evaluation, laboratory tests, and imaging to confirm and monitor the fetal development. Clinical diagnosis of pregnancy. Presumptive symptoms. Subjective reported by the women. Amenorrhea, missed period, nausea and vomiting, morning sickness, breast tenderness and enlargement, increased frequency of urination, fatigue, frequent fetal movements felt at 18 to 20 weeks in the primigravida, 16 weeks in the multigravida. Probable signs like objective observed by the clinician, positive urine or the blood pregnancy test, SCG detection, abdominal enlargement, Chadwick sign, bluish discoloration of the cervix and the vagina, Gödel sign, softening of the cervix, Heeker sign, softening of the lower uterine segment, Braxton Hicks contraction, painless and the irregular contraction, positive sign, definitive confirmed by the fetus presence. Fetal outcomes detected by the Doppler 10 to 12 weeks or the stethoscope 20 weeks. Fetal movements palpated by the examiner 20 weeks. Ultrasound visualization of the fetus. Laboratory diagnosis of the pregnancy. Urine pregnancy test. Detects HCG in urine positive as early as 4 to 5 weeks gestation. Best done with the first morning urine for the highest accuracy. Can give the false negative in very early pregnancy. Serum beta HCG test more sensitive and detects a pregnancy earlier than the urine test as early as 8 to 10 days post ovulation. Used in the cases of the suspected ectopic pregnancy or the molar pregnancy. Normal doubling time. Beta HCG doubles every 48 hours in the earlier pregnancy. Ultrasound diagnosis of the pregnancy. Transvaginal ultrasound 5 to 6 weeks. Detects the gestational sacs 5 weeks. Detects the yolk sacs 5.5 weeks. Detects a fetal pole with the cardiac activity 6 weeks. Transabdominal ultrasound 6 to 8 weeks, less sensitive than TVS for the early pregnancy, used for the routine pregnancy monitoring. Dating of the pregnancy by the ultrasound. Crown rump length, best for estimating the gestational age in the first trimester. Biparietal diameter, femur length and abdominal circumference, used in the second and the third trimester for the fetal growth assessment. The diagnostic test in the pregnancy. Complete blood count, screens for the anemia and the infection, blood group and the RH typing, important for the RH incompatibility screening. Thyroid function test to detect the hypothyroidism which can affect the fetal development. Oral glucose tolerance test for the gestation diabetes screening. DOT screening for infection that can affect the fetal health. Toxoplasmosis, rubella, cytomegalovirus and herpes. Pregnancy test to detect the HCG in urine, home test or the serum more sensitive. Beta HCG doubles every 48 hours in the early normal pregnancy. Ultrasound is the gold standard for confirming the pregnancy. Gestational sac appears at 5 weeks on the TVS. Fetal cardiac activity is seen at 6 weeks on the TVS. Crown rump length. This is the best for dating in the first trimester. RH typing is essential for preventing the hemolytic disease of the newborn. Gestational diabetes is screened with an OGT in the second trimester.